Good morning. This is Steve Stites, Chief Medical Officer at the University of Kansas Health System. Welcome back to our program this morning. We have some really special guests. I think we're going to have a great discussion today. First, of course, is my right-hand man, Dana Hawkinson, Hawkeye, Doc Hawk, or just kind of dorky guy. All of those are the right name, and he returns with us. We'll talk a little bit about how things are going this morning. But we have some really special guests as well. David Smith, who is on my left. He is the Youth Sports Medicine Medical Director and KSHHAA, that's a lot of letters there, Advisory Committee member. He's here with us this morning in the studio. Also joining us online is Royals head trainer Nick Kenney, along with head physician for the Royals and KU physician, Dr. Vincent Key. I've had enough surgeries within my family. I think I've paid for a couple of Vince's kids to go to college over the years after several knees, my shoulders, my wife's knee. You know, it's just all in the family. And so we're going to talk a little bit about youth athletics because we always get a lot of questions about, is it safe for kids to play sports? And we want to have a little discussion about that today. I'm sure we're going to end up talking about the Royals because, you know, some of us just love the Royals. I mean, love the Royals and want to talk a little bit more about that. Dana, how are we doing this morning?
We're doing good. We're doing good. You know, I was out at a different grocery store than I usually go to yesterday, and there were more people in mass, so that's good and that's encouraging.
They listen to you. That's good.
They listen to me. And one of them knew who I was and really said that she enjoys listening to you. So
well,
keep up the good work.
Enough to do. I guess that's called sheltering in place. And
that's right.
No new television
right.
and no new shows.
So, but we want everybody to stay healthy. You know, in the health system, in the hospital today, we have 20. I think we had 20 or 21 yesterday. Still 8 in the ICU and 3 of those on ventilators. So our numbers are stable, which is good. You know, we're seeing as how we're about 2 weeks out now from the original reopening or lessening of the restrictions. Hopefully those numbers can stay the same. We always anticipated our equilibrium would be 20 to 30 patients in the hospital. I think that would be great. Certainly less would be better. But getting a surge of 40, 50, 60 plus patients every day in the hospital, we certainly don't want that.
Yeah, and I think it's interesting that we're 2 weeks post really the opening in the metro area, and a little bit more than that, and our numbers have not gone up.
Right.
Even though there've been some new cases, of course,
yeah.
Testing has been. There's a lot more testing out there, so it's hard to know what to make of that. I do follow the trend lines every day, as I know you do in Missouri and Kansas, and we are seeing fewer new cases, even though there's more testing.
Yeah.
So I think that's great news. We won't know about the results of last weekend's Memorial Day parties at the Lake of the Ozarks and other places for another couple of weeks, really. So unfortunately, we just have to, hope for the best out of that.
Yeah, and we should state that when we talk about these numbers are including the discharge that we've had and the new admissions we had. So it's not just the same patients every day. We've had discharges and we've had new admissions.
And we've seen a little bit younger patient come in. For a while, we were centered around nursing home outbreaks and things like that, and now we're still getting older folks to come in. But we're seeing more young people. They come in and go out. The length of stay is a little shorter. So we're actually getting a fair number of admissions. They're just going home, that's great news. But it is still a challenge out there. Dave, as you look at it, and talk to us a little bit about youth sports and what you see as kind of, in your role as a sports medical director and working on that advisory committee.
Yeah, Steve, we are looking at this summer. The kids have had to stay home, haven't been able to go to school, haven't participated in spring sports. And so they're ready. They're revved up and ready to go. And so we get asked a lot of questions about the safety of going back. So as I said on the Sports Medicine Advisory Committee for KSHHAA, the KSHHAA.
Is that how you say it faster?
Yeah, KSHHAA is the way we say that. They came out with guidelines a couple weeks ago on the guidelines and considerations for returning to summer activities.
Yeah.
And we looked over those very closely. They're fairly general, but it's what you have been preaching for months, literally, that we have to be so cautious as we start back. KSHHAA has said June 1. Obviously, we had to follow everything that Governor Kelly and KDHE has said along the way. And so as school districts look at this, they're looking at when is the right time. Some are going to start June 1. Some have pushed it off to June 15th. Some have said July 6th. I look at it as we have to be careful no matter when we start. And these are going to be ongoing issues that we'll deal with. Youth sports, of course, runs the gamut from club sports to sanctioned sports to recreational sports to parks and rec. And so when you see evidence that this past weekend, the Memorial Day fiasco is what I call it, I sure hope our youth will be much, much smarter than the adults that I visualized on those videos.
Yeah, it's hard. So Vince, as you look at that world, are you seeing patients coming back, and what's your advice to parents with children who want to run back out and do that? And I know, just to say, you're a D1 athlete, and you have some kids of your own that are D1 athletes.
Yes, Steve. I think that parents really need to be cautious and very thoughtful in terms of getting their kids back out into youth athletics. Yeah, I have a son who plays football at Kansas State, and I have a son who plays football at Northwest Missouri State. When everything happened, they actually came home. I made them clean out their weight room downstairs, because I told them it's the only way you're going to be able to lift. And I have two other high schoolers at Bishop Miege. One plays football and one plays volleyball. So it's one of those things that you try to prepare at home as best you can. And then once they work out and things like that at home, then you have to think to yourself, well, am I going to let them go back out to play youth sports? And like you said, if there's anyone at home who is immunocompromised or folks that have had underlying lung disease or whatever, you have to take all those people into consideration because it's just not the child, it's everything around the child and the entire family.
Yeah, boy, that I think is absolutely true, and I think that's the advice we just have to give people. Folks want this to be safe, and they can just resume life as normal, and there's peer pressure, but the reality is it's not safe. This isn't normal, and you have to react to it differently. Vince, are your patients starting to come back to do elective surgeries now?
They're starting to come back, slow, trickle. I mean, everyone's cautious. I actually did a couple of Tommy John procedures on college pitchers a couple of weeks ago, a couple of ACL reconstructions, a couple of just regular meniscus and shoulder issues. So they're starting to come back. And you really see, we at times, is it a difference between are you uncomfortable or do you have pain? And you're starting to see now the people coming back for surgery right now are in a lot of pain, or they've injured themselves from landscaping. I had my first TikTok injury playing with the kids and things of that nature. So they're starting to come back slowly. And my surgical cases are starting to go up a little bit, as well as seeing patients in the office. But I still also institute telehealth as well.
Yeah, well, I'll tell you, you do good work. My shoulders are great. I could go fly fishing before, if you remember, I couldn't lift them. You shaved it all off. They work great, so thank you. So, and my miles the other day. How about that? 7 miles, I think. That's pretty impressive on those knees. Nick, talk to us a little bit about the Royals and what you do to keep pro athletes engaged at a time like this. These are not people who usually sit around. They're pretty highly motivated. They want to get out. They want to play ball. How are things for them, and what are you doing with our athletes to try and keep the Royals healthy and ready to go?
Well, I'll tell you what, it has been challenging. I really want to say that I'm extremely proud of our group. To date, we're about 95% full compliancy in regards to staying fit, staying ready when we get the call as to when spring training 2.0 will start. And that remaining 5% is just based on the fact that maybe they're in an area where they don't have access to facility to promote their health and stay ready. Or we've got situations where, like Vince had mentioned, you've got a family member that's immunocompromised, or you've got a situation where you have a new wife and baby child, and you're worried about putting yourself out into the public and bringing something back into your domicile. So we're just really proud of these guys. We try to pay attention to their mental health as well as their physical health. We're staying in touch with them, every 3 to 4 days. We're doing a lot of Zoom meetings. Our coaches are working extremely hard on trying to do virtual type training with them. Our strength staff has been exemplary being extremely creative, giving these guys ideas of what they need to do with limited resources, and just really proud of how everybody's handling this whole situation.
I'll tell you, there are two words I know we all want to hear, Nick. Play ball. We got to do it when it's safe. We got to do it when it's ready. I know. I can't wait. Yep.
I'm really looking forward to that as well, and I do think that we will have that opportunity this summer.
We're counting on it, and I don't know how many crowds or how many people will be able to be at Kauffman Stadium, but man, if they can be, I'll be looking away to get there. That's a fun time and a big event. So let's see if there's questions from our media that are listening in this morning. Anybody want to ask a question of our panel? Not hearing any there. I'm going to go to, because I know we already have a lot of public questions about youth sports and high school sports and things like that.
How do you keep them safe in the dugout?
All right. How do you keep players safe in the dugout? Man, I don't even know who wants to take that question on first.
You know,
Dave?
I will, because I'll start with the youngsters before we get up to the pro level, because, you know, Nick runs a pretty tight ship out there. And with youth sports, we don't have an expert like Nick in the dugout. So I saw that on Mother's Day weekend, there was a baseball tournament west of St. Louis for young children. And they had all these guidelines on how to be careful. And I think it was 3 in the dugout and the rest could be out on the field watching. I think that this can require parents, coaches to all be on the same page with this. And 6 feet, and we've been preaching that for months, right? We're not going to change that suddenly. The dugout is a tight space, though, and there's a lot of handling of equipment in there and the benches and so forth. Water bottles get thrown down on the floor and gloves thrown here and there. So it's going to require someone that's going to have to be a police officer, honestly. And if I'm in a youth dugout, I would say either it's going to be me or I'm going to assign an assistant coach or a parent to watch that and educate. This isn't supposed to be a punitive thing in the dugout. We need to educate these children so that they can play ball safely. And I'll turn it over to the pros now and see what they're going to do there.
How are you guys looking at the dugout?
All right, so I'll jump in. The pillars are the same. They follow you no matter where you're at, whether you're in the grocery store, whether you're at the department store, the dugout, the clubhouse. 6 feet is the major issue. You want to maintain as much as you possibly can. No sharing of items is another thing. We are going to absolutely institute a health and safety monitor where a person is going to be watching us and making sure that we're maintaining our pillars. Individual water bottles. Hand sanitizer at multiple locations on the bench, no high-fiving, no fist pumping, maintaining your social distance of 6 feet, no spitting is another thing. Obviously, that's at the pro level, that's something that happens each and every day. So now we've got to make adjustments on our habits as well. Just making sure that we're paying attention to our own actions and trying to be safe for others. I think that's the thing.
Vince, what do you think?
I agree with that. And I think that it's going to be hard because we're cultural creatures. We're creatures of habit. And from that standpoint, it's going to be kind of difficult. Someone hits a home run, what's the first thing you're going to do? You may high five, you may jump up and down, and everyone gets close together. So it's going to be kind of changing our cultural habits a little bit. From a standpoint, like Nick said, having water bottles and hand sanitizers and things like that, for me, that's my players and Nick's point there in the dugout. I'm never in the dugout unless Nick calls me down there. So I'm usually up in my office on a monitor watching the game as well.
Yeah, and what about for the high school teams? What would you say to them, Vince? Because that's kind of a funny thing in that you got kids, you think, well, they're not necessarily kids anymore. They're old enough to watch out for themselves, but they are in high school, and we know how that goes.
Correct. And so it may be actually the coaches may want to institute, if they have a team parent, whether it be a team mom or a team dad, just like Nick said, we're going to have a person overseeing what goes on in our dugout at the K. It may be incumbent on the coaches to get a lead parent or something like that to incorporate them in the dugouts.
Yeah, I think that'll be especially hard, Dave, when it comes to football season, because that's an even more crowded sideline.
Yeah. Steve, I think of it this way. One of the educational pieces we'll have for these athletes is, do you want to play sports?
Right.
Well, of course, the answer is yes. Then let's work together as a team to keep playing sports. Reopening sports is not the biggest issue in my mind. It's when we get out there, let's say one person on the team becomes ill with COVID. We contact trace. Well, obviously the contact tracing said he's been around the rest of his team. So what do we do in team sports? We play as a team, right? If you want to play as a team, then as an individual, you have a responsibility to be a team player. You come to your practice, you should have checked your temperature, gone through, are you sick, a runny nose, cough, sneeze, whatever it is. Be honest about that. Don't hide it and say, well, I better not tell them that I got this bad cough. It's just asthma. No, we need to be responsible to our team. And if we can continue to preach that message, then I think we will have safe sports. And otherwise, one contact trace from one teammate, and that shuts down the team.
It can shut down the team
and
entirely.
It changes the whole season for everybody, including the competitors that you'll be playing against.
Yeah. And unfortunately, we don't have that rapid testing as well yet for high school, college, pro athletes, sports, I think especially. I think it's coming. There was an article today, I think, that this morning that talked about how far are we away from truly rapid, reliable testing, and there's probably several months. But that'll be a bit of a game changer.
You know what? That's interesting because the United States Olympic and Paralympic Committee has addressed this already. Obviously, they canceled the Olympics for this year. They're hoping that they can have it next summer. And yet there's guidelines now for them when they can get back to competition. And one of the things that Dr. John Finoff said, who's the Chief Medical Officer for the US OPC, he said, as we have more testing, as people continue to increase, as we have this contact tracing, we should be able to do a better job advancing through each of the phases. Because to get ready for the Olympics, that doesn't mean you wait until next spring.
Right.
They've got a lot that's going on right now, so they've got this long-term program set up for how we ramp up Olympic athletes. And I look at it as, the youth sports, we're going to be the model. We're going to start youth sports before Nick and Vince get the Royals going, before the NFL comes around in the fall. So we're a test pilot for what's happening right now.
I would think soccer would be even harder because the players are out in the field and have so much contact. It's more like football than baseball from that standpoint.
Yeah, you can look at each individual sport. In fact, the Kansas Recreation and Parks has put out guidelines that are very interesting to look at, and they went through all the different sports, giving some guidelines for those. And I think of volleyball, not switching sides, so you're not passing, having 15, 20 minutes between games to make sure you kind of clear the gym. With soccer players, you're going up for headers face to face, cheek to cheek. And football players, I know that's been addressed too. They're talking about how do you keep linemen. I mean, they're face to face. So do you put a face shield on the helmets? I know that there's companies looking into that. So we'll learn as we go. My message also is that we don't have the exact right answer right now. And there's no right or wrong. But what's wrong is ignoring the facts. Yeah. And the facts is it's here.
Yep.
So.
All right, question.
Yeah, you hit a couple of them, but one follow-up is if a teammate gets sick with COVID, then what does that do to the parents?
Yeah.
Well, that's the fear, Dana, is that child brings it home.
Exactly.
In terms of quarantining as well.
That was my concern. It's not just the athletes, because we really do think most of them are younger and probably healthy. Certainly they're at less risk, but it's not only them. So it's the coaches and the support personnel as well that are associated with that team, and then of course the parents. So that's the real concern, is that the child may be around a teammate who may or may not have symptoms and does well, but then that child gets infected and brings it home to the parents, who may or may not have some of those higher risk factors and just have a higher risk of having severe illness, or even other family members. And so that's really the big concern as we move forward with that.
And I think that is such a concern, and in fact, I would again just think, to your point about, you just got to do the next right thing, and having your child get back into youth sports feels so right, but the reality is it's probably so wrong if there are sick people at home. And I would just say to you, and I'm going to look at Vince, where your kids have been so disadvantaged that they couldn't have made D1 sports if you told them you couldn't play baseball for one summer, play track or football or whatever?
Absolutely not. There's bigger things than that. And just because you miss a summer doesn't mean that your athletic career is over. So, no.
Yeah. In fact, you may save them from an injury.
Correct. You may actually do them a service. And there are some kids, speaking of that, Steve, that have had injuries. And instead of rushing them back to try to get them through the summer, there's a lot of them. I've told them, I said, shelve it for the whole summer. It's actually been a blessing in disguise for a lot of injuries. So that's not a bad choice.
Yeah. And Nick, the one thing I would think in baseball that's hard is like that pitcher, or no, I'm sorry, the catcher, the batter, and the umpire. How is baseball going to look at that?
I'll tell you, baseball is going to look different this year. I think the distances will, obviously the distance from the pitcher to the catcher is exactly going to be the same. But you're going to see that the umpire is going to be wearing a mask underneath of his face mask. You may even see the catcher wearing a mask. So we're looking through a lot of different things. We're drawing down our protocols, trying to make sure that we're concise when the time comes. But, I think that Dr. Smith made a really good point. It's not about returning. For me, it's about sustaining. It's about doing the right thing, making the right decisions, and continuing to monitor our actions, making sure that our actions are not just for us, but for our fellow man, and so that we can sustain our ability to continue to do what we want to do.
Yeah, the next right thing.
All right, so 6 feet is the distance if I'm standing and talking to you with a mask. What is it when I'm running on a field, and do I wear a mask?
All right. Dana, what do you think? This is beginning to feel more like choir practice now.
Right. We've tried to address this. I think it's going to be very hard for anybody to be doing active running or active activities with a mask on. Again, if you're in a field, you're outdoors, that helps as well. I don't think that's feasible. Me as an athlete, I would not want to be wearing a mask when I'm out running, when I'm in competition with somebody. That could make it a difficult time for sure.
Yeah, I would agree with that too. We have enough athletes with exercise-induced asthma, and putting on a mask on when it's 98 degrees and 80% humidity is going to we're going to have more heat illness. So I think it's one of those, again, that if we have coaches that are really tuned into this, they can structure workouts so they can maintain that 6 feet. But think about a cross-country race. I mean, they're all packed in. What are you going to do? You stay 6 feet apart, don't pass me? So I don't know. They're not going to wear masks, I guarantee you. No runner's going to wear a mask. But if an athlete chooses to wear a mask in practice, we have to be careful and not have teammates bullying him, making fun of him. He may choose to do that. But back to your point, it's going to be one of those, if you've got immunocompromised parents, friends, family, anybody around, older folks that you're going home to, it's going to be one that you're going to have to make a hard decision. And the kid can't make that decision. They don't have the ability to look at the whole scope of things.
Yeah.
So.
And also take into account, we always need to make sure that the mask itself is dry.
Yes.
And so if it's getting saturated with sweat, or if it's raining out and you're playing in the rain, that is really not going to be too useful. So we need to make sure that the mask is dry as well.
I think the other problem is that with the heat, when we breathe, although we're not like like a dog, in which although sometimes my wife may think I bark like a dog, but the masks may make you retain heat a little bit more, which could actually be a bit of a problem. So you would have to watch for heat exhaustion and heat-related illnesses as well. That'll be an important part.
Indoor sports versus outdoor play.
Yeah, Dana, we've said for a long time that indoor is just a little bit different environment than outdoor, but it's still really about spacing.
Mm-hmm. Yeah, I would definitely prefer the outdoor, just because of you can probably do spacing a little bit easier, and it's not a confined area.
Yeah.
And I would agree with that. If I look at some of these school districts that already have their protocols set up to start back to sports, going back into the weight room is way deep into the phases. You can structure strength workouts. I know Nick could address this, where you can do them outside. You don't have to have weight equipment to do that. So I would be interested actually in Nick and Dr. Key's.
Yeah, let's see what you guys think about indoor versus outdoor, and then I have a follow-up for you after that.
So, Dave, you're right. Workouts can be structured to where you have the proper spacing, make sure that you group appropriately. You have specified times for a certain amount of athletes. I'm just throwing numbers out there. Maybe you bring in 4 to 6 athletes at a time in a 1-hour block, and then you only make certain pieces accessible to them, and you try to bring those pieces into the outdoors. We've actually, done that at our Arizona complex because we feel like that we're putting our players at a better safety situation. And then they've been able to continue to maintain their physical fitness. On top of that, it's something new, something fresh. It's given our strength and conditioning coaches an opportunity to be really creative. I think our players have enjoyed that creativity. I'm not going to tell you that they wouldn't like to be back into the weight room, but they're realizing that that space can be utilized a little bit differently. Doing it in an outdoor space has given them the opportunity to maintain their fitness in the way that we need them to. And we feel really good about where our guys are right now. We feel like that we're 2 weeks away from being ready. That's been our whole goal this whole entire off season. Stay 2 weeks away from getting into games. And because of our strength staff, the creativity of our strength staff, like I said, looking after each other as teammates, following the guidelines, making sure that those guidelines go with us in every space that we're in. We've been able to get some good work in. So no, you don't have to do it inside. You don't have to do it in the weight room. But I'll tell you this: if you're gonna work out with weights, make sure that you're not sharing the weight. I know that people are sitting there saying, "Well, how can you do that?" Well, here's how you do that. You use that piece for all 3 sets. You clean it before. You use it for the 3 sets, and you clean it afterwards. And then you can do a rotation and allow another athlete to come in to use that apparatus. So that's what we're doing.
Vince?
Well, and Nick hit all the points. Creativity is the key in getting out of our old ways. I know sometimes I tell people MD stands for make do. And you have to be creative in what you do. You can do stuff outside. You can do different things with different weights, just like Nick said, doing a set of 3 yourself and then moving on. I think the distancing is very, very important. Having guys come in small groups. That way you give your 6 feet or more. And again, just being creative. And I think Nick and Ryan Stoneberg, all of our strength and conditioning guys with the Royals have been really, really good. And it's those simple things that you can even take to your home. So again, kids can do strength and conditioning things different ways. There's been a lot of people using resistant bands, using soup cans or whatever. So there's a lot of different ways to get your strength training in, not just the old-fashioned ways.
Yeah, that is so true. Okay, so here's the one thing I know. We are blessed by great sports teams in Kansas City between sporting. Looked like they were going to have a great year this year. Being out to be at the Cauldron out at the Children's Mercy Stadium, going to the Royals games and hanging out at the K and walking around. What a blessing that is. And of course, there's nothing like Arrowhead. When do fans get to go back and experience that time? Because those are, we really, that's pretty cool. And if you're a Jayhawk, man, there's nothing like Kansas basketball, right? That's just the best thing. So what do you do? What are you thinking about fans? Nick, what are you guys thinking about having fans back at the stadium?
We would love to have fans back. That's what we're striving for, is to get fans back in the stadium. That's what we play this game that we love. Because of the joy that it gives ourselves and the joy that it gives others that watch it. So we can't wait to get people in the gates and watch us play. But you know what? That's going to come down to recommendations of Major League Baseball and a centralized approach, as well as what Mayor Lucas thinks about the whole entire situation and Governor Parsons. So there's going to be some other people who are going to have some say in what we do and when we do it. And then Major League Baseball will be really directed in how we do it. But I'll tell you this: we have a task force that meets every Wednesday. It's an organizational task force. Our physicians are involved in that. We've got city members that are involved in that, and obviously members of our organization. And we are working feverishly to try to come up with a plan that will promote the health for our fans that come in the doors of the K.
Vince, I bet you're probably part of that.
Yeah, every Wednesday we have a call, and we talk a lot about how we're going to do it in the global, because you just think about, okay, well, I want to go to a game, I want to sit in the stands, but there's so many layers to that, and there's so many things that we got to check our boxes in terms of that, and so it's a multi-step approach, going all the way from the top in MLB, working down through the CDC, working down through the state and local health cares and the mayor and everyone else. So everyone has to be on board as to when we're going to do this and do it safely for the fans, because the number one thing is the safety of our fans. And, I think that is paramount. At least, hopefully, we can, if we don't have fans in the stands, then maybe, obviously seeing it on TV is better than nothing. You saw that from this weekend with the golf. How many people watched that event? And so we're all clamoring and we're all wanting sports, but the number one thing is to make it safe for everyone.
All right, is lacrosse safer than volleyball? Is it okay to get back to lacrosse? We're getting a lot of individual sports. Can you speak to that?
What do you think?
I'll just speak to that, because I'm not dividing up into sports. You could say cross country could be safer than football because they're not face to face, but they're side to side. So if we get into that argument, I could debate that till the cows come home, because if you have a lacrosse team that is practicing what we just talked about, okay, they're a little closer than maybe volleyball across the net, but it's outside versus inside, and you can go through all these little math factors to figure it out. So what I would say is, take these points that we've all discussed this morning and go back to your club or your whatever sport you're going to do. Make sure that the coach is on board. Make sure all the parents are on board. We talked about there's the fans in the stands. Well, the fans in youth sports are parents and their friends and family. And I watch parents all sitting close to close in bleachers. I've been a parent at those bleachers, and I guarantee you, in indoor gymnasium and summer basketball, for me, it's not going to happen. When I did that with my son. So the Parks and Rec is going to have to be on board with this, and yet they're going to ask those questions. Is lacrosse, is football, is cross volleyball? Do we switch seasons? Does football go to spring and baseball go to fall? Those are all being knocked around. And when we get to the Olympics next year, who knows if this is going to be settled down by then or not? Depends on the vaccine.
So Dana, what do you think?
And wrestling, that's kind of the joke. Let's have 6-foot wrestling. What do you do?
Yeah.
Line up 6 feet apart and do this, and one falls down and one stands up. So wrestling isn't going to happen until
not until we're.
Right.
So Dana, what are your thoughts? Because I think that when you try to start weighing one sport on another, the base of sports is there's a competition, and it's a competition between people. I think even curling, you could say, oh, you're still getting close, right? And people could still breathe hard.
Yep.
And it's that breathing hard. This is a respirable disease. So breathing hard is really the key. And I'm not sure that when we try to parse it out from one sport to another, indoor versus outdoor, that really we're doing a favor to it.
Right. I think in general that is probably correct. They've even looked at curling. That was probably a Canadian research group, but they've actually looked at that kind of thing as well. So I think the main tenets continue to be you have close interaction. So how can we mitigate that when you can? Outside of the competition, but also in the competition. Obviously, baseball will be a little bit easier unless you're the batter, catcher, and umpire. So I think, it's hard to get into those details, specific details in the weeds of all those specific sports, but you have to continue to maintain the pillars that we've talked about and then work through that based on what you know about your sport and try to continue to do all those things that you can, especially the physical distancing, not sharing equipment, things of that nature.
You know, the one sport that I think would probably be okay is competitive fly fishing. Okay, I'm a fly fisherman. Come on, people, work with me here for a second.
You know, Steve, think too about marching band, cheerleading.
Oh,
I mean,
no,
the
there's no way
formations
you can-
are different.
yeah.
The cheerleading are not going to be doing pyramids, and so it's that things just have to be structured differently.
We just have to think about the world differently.
Yes.
Until we don't have to. And the thing that's going to make us not have to is if we get a vaccination and effective therapy, or SARS-CoV-2 begins to die off. I mean,
Right.
that would be a great outcome if we'll do
That'd be
that
the
by
best.
itself. Yeah.
Okay, I know we're getting close to the end.
We
I want
are.
to acknowledge that we have a ton of questions that are more science related, like to the COVID strain, wearing a mask, and we will get to those tomorrow, I promise, whenever Dr. Lee Norman, and you can talk about that.
Yeah.
But two final sports related questions. One of them is, if I have a child who has asthma, is that person more at risk for COVID? And your favorite question, Dr. Smith, should we wash the balls?
All right, let's start with washing the
Oh,
ball.
you want me to do
Yeah,
the ball?
take that
I
one
figured
first.
that would, okay. So how do you possibly, I've seen, well, every once in a while, throw the baseball out and get a new one, you know, or we wash the volleyball between sets or something. You know, it's impossible to play a sport with a ball that you're touching and stop it every time you touch before it touches someone else. So the easy answer for that is play with the ball. Keep those hands away from the face, wash them often, and okay, once in a while switch out the ball while someone's washing the ball. I mean, my hands stay down from my face unless I'm putting my mask on, and then I go through the protocol of wash, mask, then when I'm ready to take it off, wash, take it off, wash again. So we're going to have to do a lot of educating, but the ball question has come up, and I kind of smile. In fact, I've considered making a video of the different sports in the COVID area and how it would be impossible to do some of these, but it can be done. That's a long answer, but it can be done with the
it
ball.
can be done. So Nick and Vince, final thoughts as we wind up for today's program about where things are and the things that you're preparing for. And would you let your child play sports?
All right, I'll jump in on this one.
Okay, you go
You know
first,
what
Nick.
Thanks. You know what? I would I would let my child play sports if it's appropriate to. You know, there's been a lot of great things that have been said in regards to, you know, if you have a member in your family that is immunocompromised, and the risk of allowing your child to play a sport would bring something back to that person that's in your household, then you certainly have to weigh that a lot deeper. But you know what? There's something about the interaction that goes on, the life lessons that go through sport, that has always made it extremely appealing for me, and obviously all my kids. All my kids have been athletes. We enjoyed watching them play. And you know, there's certainly something to be said for making sure that everybody's physically active and physically fit. That certainly leads to health along the way too. So, you know what, I think that we have to respect this virus. I think that we have to make the right choices in regards to it. But I think that we can't stop living to not die. So I think if we maintain our pillars, like Dr. Smith said, if you look at what you're trying to accomplish and you can't maintain your pillars to accomplish it, then you have to make a different choice. And remember those pillars as far as trying to create your distance, covering your cough and sneeze, making sure that you're washing your hands, early, often, not touching your face, your mouth, your eyes. If you can't do those things, then you can't protect yourself. And if you can't protect yourself, then remember there's other people in your family that you probably won't be able to protect either. So you got to factor all those things in. But I certainly, if we could maintain those pillars, I would let my kids play sports.
Vince Key, what do you think? Play sports, not play sports? What are your final thoughts?
I agree with Nick. Would I let my children play sports? Yes. Again, it's one of those things where, just like Nick said about fear, you can't fear it, but you need to respect it. And to respect it, you have to do the right things. And to do the right things is going to enable you to at least, if you're going to play, mitigate your risks. So from that standpoint, I think it's going to be incumbent on every parent to look at the relative risk, depending on the sport, depending on other things at home. I think, again, it's a choice that we all have to make, not only for ourselves, but for others, whether it be the people at your home or the people in your community. So I think it is important from a mental aspect, and we've talked about that. Nick and myself, Ryan Maid, have talked about the mental aspect, the social interactions of playing sports. And so all of those things are important. Heaven forbid, Steve, that my youngest two kids got sick. Your wife would kill me because she's the one that delivered both of them. So, but
then she'd come to me.
Yeah, exactly. And so I think it's important that, again, we respect it across the board. We do the right things, and we try to stay as healthy as possible. There's not going to be anything that's going to be 100%, but let's try to keep it as close to 100% of being safe.
And if somebody asks you, is the operating room a safe place?
I tell them that it is. We've been doing all the precautions coming from once you're in the operating room, that the anesthesiologists are in there first. They wait for approximately 6 minutes for the air to clear and to circulate. And then I walk in and do the procedure. Once I'm finished with my procedure, I walk out. The patient is awakened, and then there's another 6 minutes to clear. So I think that we're doing everything in the operating room, and more importantly, I think we're doing everything prior to the patient getting to the operating room. All of my patients are going through COVID testing, and they're self-quarantining for 48 hours prior to even coming to the facility. And then they get checked at the facility, and then another questionnaire before going into the operating room. So I think we're doing everything that we can to mitigate that risk. And it's to me, we're doing everything to make it as safe as possible. It's a risk just doing surgery in general. We don't want to add risk because of COVID.
And I think you guys are doing a great job. And just to say, we haven't had a case of transmission or a patient getting COVID from a staff or vice versa here in the hospital. So we're very lucky about that. But I think a lot of that is a result of hard work. Dave, your thoughts about youth sports?
Yeah, I would let my children play sports. They're grown up now, but I'm going to have my first grandson here in July. And obviously down the line, I hope that this young man will do an activity, whether it's sports or something else. I always think of the many choices we make in life are based on the risk-benefit ratio. And if the risk is greater than the benefit, you step back, you evaluate it further, and maybe you say no. If the benefit is greater than the risk, then go for it. But again, using our smarts. And so the benefits of sports go beyond the exercises, medicine, physical things. The mental health, we didn't really hardly touch on that. But the mental and emotional health I worry about right now with our youth. And I think that sports, exercise, activity will really help mitigate the risks of some mental health issues that we already are hearing are going up because of what they're dealing with through this time. So absolutely.
Dana?
Absolutely. The short answer to that is yes. There are caveats. I want to know when and where, and does the club or the league or the team have precautions in place and continue to get the message to parents? Make sure your kids don't come if you're sick, things of that nature. What other kind of precautions are in place from the league about separating and sitting on the bench or in the dugout, things of that nature? But absolutely playing sports now. I don't know, again, if I'll be doing the carpool home, putting 6 other people not from my household into the minivan and driving them home, but certainly playing the sports, absolutely.
And you do have that cool minivan. I've seen it all decked out. That's pretty nice.
It's good.
It's pretty good. So, my take maybe just slightly different. You got to know what you don't know. There's a whole lot we don't know about SARS-CoV-2, and that concerns me just a little bit. We don't really know what some of the long-term complications are, even for people who get the disease, and how healthy they're going to be. And we don't really know as much about all the long-term complications, and we're seeing more information about children, the topic we're going to try to be addressing next week. everybody has to make an individual decision, understanding you don't yet know all the risks of SARS-CoV-2 because we just don't know enough about it yet. It's not been something like influenza that's been around for years. It's a mutation of an old virus that's clearly causing more death and destruction than it had before. So we just have to be really cautious. You have to think real carefully about what's going on in your home and about the health of other people around you, because children will often be asymptomatic with it. So just be careful and remember that these kids are not going to get permanently scarred for life if they don't participate. But you could have a permanent loss of life if they participate and bring something home. It's just something you have to consider. It doesn't mean you do or don't do it, but you have to remember that this is, I think to the point you made, David, this is a risk, and you just have to do your own personal calculus of how best to handle it. And you have to know how safe that team is and how hard they're going to work to keep those kids safe. And by doing that, keeping those parents safe. And by doing that, keeping society safe. We are all in this together, and our actions that we take every day will determine how we do. That's, I think, the thought from today. Tomorrow, pretty special thing, too. We're going to talk about temperature screening, and we're going to talk about just the state of the disease here and in Kansas. We'll be joined by KSHHAA Secretary Lee Norman, along with, of course, with Dana and I. And Chelsea Smith will be coming back to talk to us a little bit more about the community blood bank. Until then, remember, stay safe, and still, there's no place like home, because soon enough, what we want to do, play ball. See you tomorrow.